Hello, this is Lheineichong Touthang. Today I'll be presenting on the topic respiratory system and some other diseases through respiratory system. So we know that respiratory system, the simple term is that we breathe in oxygen and breathe out carbon dioxide. It is the gas exchange between the body and the environment. And this respiratory system has been divided into upper respiratory tract and the lower respiratory tract. And we also see in this picture, the upper respiratory tract consists of the head and neck, such as nasal cavity, pharynx, and larynx, and the lower consists of thorax, which are consisting of the trachea, bronchi, bronchioles, and alveolar ducts, alveolar sacs, and alveoli. So today we have I want to narrate some of the um, upper respiratory system and the lower respiratory system, where they are located, and some of the functions. So the first thing in the upper respiratory system, as we know, is the nose and the nasal cavity. And this is located at the front of the face, above the mouth. And this nostril allowed air to enter inside our body. This nasal cavity located behind the nose is lined with mucus and membrane and tiny hairs that filter dust, bacteria, and other particles. And the function is it warms and humidifies incoming air before it reaches the lungs. So the second is the pharynx, which is also known as throat. So the pharynx is a muscular tube that extends from the back of the nasal cavity to the top of the esophagus and larynx, and it is divided into three parts as nasopharynx, oropharynx, and laryngopharynx. This serves as a passageway for both air and the food. And the next is larynx, and which is also called as voice box, which is located at the top of the respiratory tree. It is below the pharynx, and this acts as a passageway for air to move from the pharynx to the lower respiratory system tract. And they contain the epiglottis, a flap of cartilage that covers the trachea during swallowing to prevent food from entering the airways. So this can help us from danger that the food should not be entered in the airways. In the next, we go to the lower respiratory system. So some of these respiratory system which are in the lower part are trachea, and this is extends from the larynx to the bronchi, running down the neck and the chest towards the lungs, and it reinforced with C-shaped cartilage rings to keep it open and lined with cilia and mucus to trap and remove the debris from inhaled air. And we also have bronchi and bronchioles, and these are divided into two parts, the right and left bronchus. The bronchi distribute air into its lung in the right bronchi lungs and the left lungs. And these bronchi and bronchioles are lined with smooth muscle that can constrict or dilate. So we also have lungs. And these lungs has two spongy organs. They are located in the chest cavity on either side of the heart. The right lung has three lobes and the left has two lobes. The lungs are responsible for gas exchange where oxygen is absorbed and carbon dioxide is expelled. And we also have alveoli in the lower respiratory system. These are at the ends of the bronchioles inside the lungs, and they are the tiny sacs which are over 300 million in the lungs, where gas are exchanged in this place. The alveoli are surrounded by capillaries, allowing oxygen to diffuse into the blood and carbon dioxide. And we also have diaphragm, which is a large dome shape muscle located at the base of the lungs. It acts as the primary muscle of respiration. And they contract during inhalation and creating negative pressure that pulls air into the lungs. It relaxes during exhalation, pushing air out. And we also have the next topic, we'll go to the mechanism of inspiration and expiration. So during inspiration, as we know, diaphragm will contract and there will be energy released from there. So when the diaphragm and external intercostal muscle contract, causing the rib cage to expand and move outward and expanding the thoracic cavity and lung volume, they create a lower pressure within the lung than that of the atmosphere, causing air to be drawn into the lungs. And during expiration, the diaphragm and intercostal relax, causing the thorax and lungs to recoil. The air pressure within the lungs increases above the pressure of the atmosphere, causing air to be forced out of the lungs. And this mechanism is based on Boyle's law, in which the absolute pressure exerted by a given mass of an ideal gas is inversely proportional to the volume, and it occupies if the temperature and amount of gas remain unchanged within a closed system. So I'll be giving some definition on respiratory volume and the capacity. Respiratory volume is a term used for various volumes of air moved by or associated with the lungs at a given point in respiratory cycle. And it refers to the various amount of air that can be inhaled or exhaled by the lungs at different stages of when during the breathing process is going on. And respiratory capacity is the combination of two or more selected volumes. It refers to the maximum amount of air that the lungs can hold and exchange during breathing. And this vital capacity is the amount of air a person can move into or out of their lungs, and this is the sum of the volumes except RV and ERV and IRV. The inspiratory capacity is the maximum amount of air that can be inhaled past a normal tidal expiration. And the functional residual capacity is the amount of air that remains in the lung after a normal tidal expiration. So the respiratory capacity or lung capacity has a crucial relationship with the circulatory system, as the lungs primarily function to exchange oxygen and carbon dioxide with the blood, which is then circulated throughout the body by the heart, meaning that any dysfunction in either system can significantly impact the other's ability to perform its primary function. Essentially, the respiratory system provides the oxygen from a circulatory system to deliver to tissues, and the circulatory system that oxygen to where it is needed, that can carry oxygen to where it is needed. So many conditions can affect this or our body, organ and tissues that make up our respiratory system. While breathing the air with the irritants and germs includes virus, bacteria, and fungi, and this cause infection. So there are many things that can harm our body, which cause damage or genetic diseases. So there are many types of diseases that affects the lungs and other parts of our respiratory system. And this mostly the respiratory diseases may be caused by infection, by smoking, tobacco, or by breathing secondhand tobacco smoke, radon, asbestos, or other forms of air pollution. And these respiratory diseases include asthma, chronic obstructive pulmonary diseases, pulmonary fibrosis, pneumonia, and lung cancer. And they are also called lung disorder and pulmonary diseases. And these some of the diseases which I selected are given as follows. So the first one is emphysema, and this is a chronic obstructive pulmonary disease, and it is a destruction of lung alveoli leading to decreased lung capacity and shortness of breath, often associated with smoking. And the Second disease that I select is asthma, which is also defined as a common chronic respiratory condition that causes difficulty breathing due to inflammation of the airways. Asthma symptoms include dry cough, wheezing, chest tightness, and shortness of breath. And chronic bronchitis is also another disease of respiratory system. It is a long-term inflammation of the airways that leads to a persistent cough and mucus production. It is typically defined as productive cough that lasts for at least 3 months in 2 consecutive years. Persistent inflammation of bronchial tubes with excessive mucus production causing chronic cough. And the last that I select is lung cancer. It is a malignant disease that develops in the lungs, typically in the cells lining the airway or the air sacs, or which can be called alveoli. It is characterized by uncontrolled growth of abnormal cells that form tumors in the lungs. People who smoke have the greatest risk of lung cancer. And this risk of lung cancer increases with the length of time and number of cigarettes smoked. And best thing can be quitting smoking, even after smoking for many years, significantly lowers the chance of developing lung cancer. So lung cancer can also happen in people who have never smoked, and the lung cancer cannot be diagnosed easily. So the most common risk factor for lung cancer is cigarette smoke, and other risk factors can be including radon exposure, workplace exposure, including asbestos, diesel fumes, secondhand smoke, air pollution, radiation exposure from frequent CT scans of the chest. So how to avoid this lung cancer? Maybe the first thing can be quitting of smoking. So we need to make a commitment to quit smoking, which will be the best thing, but it can be also difficult. Or we need to stay away from smokers and places where you are tempted to smoke. So there are some activities we need to do to avoid lung cancer, how to prevent it. So exercise is one of the things, or do some hobbies that keep your hands busy, and deep breathing when you have the urge to smoke. If you're a smoker, do a deep breathing exercise and remind yourself that you have to stop smoking. Or we have to find alternative ways how to avoid smoking. So we need to use oral substitutes such as sugarless gum, hard candy, and carrot sticks. Drink of water, or use as an oral substitute such as water or some other items that can prevent us from smoking. So these are the things that I listed from for this presentation. Thank you. Ini saluk kamu. Ci doahi yes katiran.